In this video, we will be talking about newborn breastfeeding and bottle feeding guidelines. The key takeaways from this video will include the current breastfeeding recommendations, how often to breastfeed, how to recognize signs that your baby is hungry, and how to recognize signs that your baby is full and getting enough milk. To begin, we will talk about the current breastfeeding recommendations. The American Academy of Pediatrics currently recommends exclusive breastfeeding, which means only breast milk until your baby is 6 months old, which is when solid foods are beginning to be introduced. They then recommend continuing to breastfeed in addition to introducing solid foods until your baby is 12 months of age or older, as this provides the best source of nutrition for your baby. Breastfeeding can definitely be continued past 12 months as long as both you and your baby are interested. So how often should you breastfeed your baby? Babies should be breastfed when they show signs of hunger, and newborn babies usually eat at a minimum of 8 to 12 times in a 24-hour period, and shouldn't go longer than 2 to 3 hours between feedings during the day, or 4 hours at night. By 2 months of age, your baby can usually go 3 to 4 hours between feedings. It is important to make sure that you are feeding your baby often enough, even if you have to wake them up during the night initially. So how can I tell that my baby is hungry? Common signs that show your baby is hungry include putting their hands to their mouth or putting things in their mouth, turning their heads to your breast or bottle, puckering, smacking, or licking their lips, making sucking noises or motions, clenching their fingers or fists to their tummy, and crying can also be a sign of hunger, but typically this is a late cue and they show the other cues before they cry. Common signs that show that your baby is full include starting and stopping feeding often, unlatching themselves often while breastfeeding, spitting out or ignoring the bottle or breast, slowing down or falling asleep, fidgeting or getting distracted easily, or turning their heads away when offered the breast or the bottle. So how to tell if your baby is getting enough milk? So your baby should have a steady weight gain, but this will be closely monitored by your baby's healthcare provider at their well-child checkups. If your baby seems satisfied and happy for 1 to 3 hours between feeds, if they have enough urine and poop output, and if you can hear swallowing sounds while feeding once your mature milk comes in. So now let's talk about bottle feeding. Breast milk is the best source of nutrition for babies, but some mothers choose not to breastfeed or can't breastfeed, in which case they will need to feed their baby formula. It is best to speak with your baby's healthcare provider when deciding on what formula to use for your baby, but formulas can come in liquid or powder forms, and some brands are covered by WIC. Your baby will show the same signs of hunger and fullness as a breastfed baby, so it will be important to recognize your baby's hunger and fullness cues. So how often should formula-fed babies eat? Formula-fed babies eat every 3 to 4 hours. If your baby is sleeping longer than 4 to 5 hours at night, it is important to wake them up and feed them to make sure that they are getting enough to eat. So how much should formula-fed babies eat? For the first month of your baby's life, they should eat about 2 to 3 ounces of formula every 3 to 4 hours. After the first month, your baby will usually eat 4 ounces every 4 hours. Whether you decide to breast or bottle feed your baby, each baby is different, and you will eventually develop a feeding schedule that works for you and your baby. Enjoy the bonding time and watching your baby grow, and always reach out to your baby's healthcare provider with any questions or concerns. Thank you so much for watching this video.